Yeah, you can.
Good evening, everybody. On behalf of Rehab Science Group, I, Dr. Shagun Agrawal, welcome all the guests, our esteemed guest, Dr. Jed and Dr. Dharampani Pandey. Rehab Science Group is organizing all these free YouTube lectures for all the students of physiotherapists from all over the world. I would request all the students to subscribe the channel and just send up their suggestions on which topics they want to go for the discussion. If from the previous lectures also, if there are any questions are there, they can just type on the YouTube and definitely we would give the answers. I will just hand over to the Dr. Dharampani Pandey to introducing up today's our guest. Thank you, Dr. Dharam.
Yes. Yes. Thank you, Dr. Sagun. And here we have with us Dr. Jad from Lebanon. And he is a very eminent person in field of stress management, pain management. He has done a lot of courses, a lot of workshops regard to stress management all over the world. He is a very eminent person in field of stress management, and however it is related to pain management and all that. So thank you, Dr. Jed, to accept our invitation, and hope that everyone will get benefited with this, especially this COVID scenario here all over the world, where everyone is in stress, what is going to happen and how we can tackle the situation. And definitely your session will definitely help people to understand the core things, how we can manage our stress. So with this note, I'll request everyone to please subscribe this channel so that you can get updated lecture from the national and international faculties. And there are a lot of courses lined up, so you can get benefited. So please do subscribe the channel. And with this note, I again thanks to Jad for accepting our invitation. Thank you, Jad, and you can start your session now. Over to you.
Okay. So hello everyone. I'm Jad Wahbe. I'm specialized in stress and emotional management, and I want to talk to you a little bit of the importance of stress management in the field of physiotherapy and osteopathy and manual therapy. Stress and emotional management are essential, and in order to understand how important the stress management and the stress aspect is in the field of physical therapy and musculoskeletal disorders, we need to look at the patient from the biopsychosocial model. I'm sure you're familiar with the biopsychosocial model. If not, it's easy to Google it and research a little bit about it. We're not going to develop too much, but I highly invite you to go and research the biopsychosocial model. Just in a few words, in a nutshell, the biopsychosocial model. So we have the biological aspect, the psychological aspect, and the social aspect, and the three are interactive, which means biopsycho, the psychological aspect, can affect the biological aspect. More specifically, our beliefs, our thoughts in the psychological aspect, in our subconscious mind, can affect easily. Pain can affect easily the threshold of pain, can affect easily the muscle tension and the muscle spasm in the body, and can easily affect too the sleep. So these three patterns, the pain and the threshold of pain, the muscle tension, and the sleep, are highly affected by the stress. Even though it's a biological aspect, but it is scientifically proven now, but now from so long, that the psychological aspect will affect very easily these three components. And as you all know, as physical therapists and osteopaths, when we deal with pain management and when we deal with pain, a big part of the pain is linked to stress and with muscle tension. And sleep is so essential. You cannot treat any musculoskeletal disorder if you have a bad sleeping pattern or if you have insomnia. The lack of sleep will make you as if you're trying to swim against the current of a river, and it's impossible. You're gonna need so much session, and the patient will be, and the pain of the patient will be so much resistance. So first we need to address sleep. And as physical therapists, we tend not to really give a lot of importance, sometimes not even in our questionnaire, to ask the person how many hours per sleep is, are there any changes of his sleep. Not we are used to ask mainly if his pain is affecting his sleep, if because of his pain he's waking up sometimes. But we forget that if he doesn't have the needed amount of sleep and the needed hours of sleep that he is used to, the threshold of pain will decrease and he'll have much more easier pain. The same stimulus will become much more painful, and same, he'll have more and more muscle tension. So we need to ask about sleep independently from the fact if pain is interrupting sleep. We need just to understand the sleep. Now, if pain is interrupting sleep, and there is a sleep problem, then sleep will create more pain and more pain will affect the sleep, and we are in a vicious circle. And the golden rule, every time there is a vicious circle, we cannot work on one side of it. We need to work both at the same time. So we need to work on pain management, but at the same time, we need to work on sleep, because if we improve one and not the other, the vicious circle will stay there. So that's a golden rule. Every time we have a vicious circle, we have to break it from two sides. One side is not enough. Okay, so we will be talking, I'm gonna share a little bit my screen. You know, most of what we'll be talking about will be mainly not based on the PowerPoint, just to show you the skeleton of what we'll be doing. So we'll be working about and talking about stress management for insomnia, for pain, example, joint pain, and stress management for muscle tension. So first, let's start talking, and we will be talking about insomnia from a breathing perspective, the stress management for insomnia from breathing perspective. So we'll talk about two breathing exercise. We'll talk about mindfulness meditation, accounting techniques, some positive planning, sports, and social communication. And we will develop it to the max. And once we're done, we'll tell you how we can use the same techniques and the same tools, just modified a little bit to target pain management and muscle tension. Okay, so let's start first with the breathing. Breathing is an evidence-based practice to reduce stress, at the same time to reduce stress and improve sleeping. So we have something called cardiac coherence. Okay, it's an app on Androids. You will see this logo, you know, cardiac coherence. You will see this logo for the Androids, and for the iPhone, you will have this logo. It is called something else. It's called Respirelax. And in Androids and like Samsung, the application is named cardiac coherence. Okay, so let me explain to you the concept of cardiac coherence, which is a highly effective technique to stop the overfiring of the amygdala and the secretion of cortisol in the brain and in the bloodstream. And by decreasing the overfiring of the amygdala, we decrease in a very important way, up to 70%, the amount of anxiety and stress. And by doing that, we are helping the person or our patient to sleep better. Now, what's interesting is that we can teach our client these techniques by online sessions. So now with the lockdown, I know you cannot see your clients, but what's good is I'm going to try to give you all the tools that we're going to talk about are tools that you can use with online sessions, right? So that's what's nice in that. So let me tell you about the principles of cardiac coherence. So when you open the cell phone, you will see a small ball here, okay? And the ball will be moving up and then moving down in a very constant way. 5 seconds the time of moving up, 5 seconds the time of moving down, and it's a very continuous, constant movement. 5 seconds up, 5 seconds down. Now, the target is to follow this ball. When the ball is going up, we need to breathe in at the same time. We need to be, or we need to teach our client to be fully synchronized with the ball. As long as the ball is moving up, the client needs to breathe in and with the same speed. So if the ball is moving up slow, it's a slow breathing in. Ball moving down, slow breathing out. So that's the movement of the lungs. I'm going to mimic and I'm going to do the exercise a few times in front of you. Okay, and this is the lungs, this is the ball. It should be like this. People suffering from stress usually tend to be faster than the ball. So they will breathe faster than the ball and wait for it. Stop breathing, wait for the ball, then breathe out fast and wait for the ball. This is what should be avoided. So you should teach the client to be fully synchronized, same speed. As long as the ball is moving up, the chest should be moving up. As long as the ball is moving down, the chest should be moving down. No faster than the ball, than waiting for it. Okay, that's a key point to do this exercise. And it's tremendously effective. Now, it's recommended to promote sleep and to treat insomnia to do this exercise at least 10 minutes at bedtime. Okay, when it's time to go to bed and everything is shut down, we're in the bed ready to sleep, we put the cell phone, we put the screen, and we do this exercise for 10 minutes. Okay, so this is a very important part. Now, it can be done more for highly anxious and highly stressed people. It can be done up to 20 minutes. Okay, some people have hard time to do it for more than 5 minutes. Then it's a trainable faculty. They do it 5 minutes, the next day 6, 7, just like a muscle training. We increase the weight. Here we're increasing the time. So that's the first breathing evidence-based exercise. The second breathing evidence-based exercise for insomnia and decreased stress to promote sleep is the exercise that we call 5-6-7 exercise, or 4-5-6. Now, 5, the first number, is the time for the breathing in. We breathe in for 5 seconds. And then the second number, +1, is first number, +1 is the time for where we hold our breath. So we should hold our breath, or teach our client to hold their breath for 6 seconds. So breathe in 5, hold the breath 6, and breathe out super slowly for 7 seconds. So if the breathing in is 5, then apnea 6, breathing out 7. For older people or people with lung issues, lung problems, or lung disease, sometimes doing 5-6-7 is too hard. We do 4-5-6, which means the breathing in time for a second, apnea 5, and 6 breathing out. If it's really hard and we have an advanced deterioration of the lungs, we can do 3-4-5, right? The principle is the same. The time of the breathing in +1 apnea, +1 plus 2, the breathing out time. Now, this exercise is specifically effective for people who might suffer from some kind of anxiety attack or panic attack when it's time to sleep. A lot of people, when it's time to sleep, they have nothing to do, they're not busy anymore, and the negative thoughts and their fears and worries come to the surface, and sometimes they create some kind of anxiety attack with a lot of palpitation and sweating and muscle tension and sometimes shivering. Okay, this exercise should be done for at least 3 to 5 minutes to calm down and to neutralize the panic or the anxiety attack, and then we do the cardiac coherence. So if the situation of the person when it's time to sleep is highly intense stress, then we need to do the 5, 6, 7 first, then we go to the cardiac coherence up to 10, 15 minutes. The longer, the better, up to 20 minutes. Okay, now second, the mindfulness meditation. Now, the mindfulness meditation is also an evidence-based practice, which is in fact, which is inspired from Indian techniques and Indian meditation techniques. So it's just remodeled in a scientific way with a lot of studies to prove how effective it is for the stress management, and it was developed in a modern way with many versions. Okay, so I'm gonna ask you to put, if you have earphones, if not, better to put your earphones to isolate yourself. I'm gonna guide you through 10 minutes of guided mindfulness meditation, dissected into 3 levels, and then once you open your eyes, I'm going to explain to you what were the 3 levels and how we can use each level for the next topics, which are pain and muscle tension. So sit down comfortably, relax, better to put earphones so you're not bothered from noises. You can close the door, take few seconds to arrange the atmosphere around you to be the calmest possible. So I'm going to give you a few seconds to manage that. Okay. Now I want you to sit down in a relaxed way, in a relaxed position, and close your eyes and take your attention to your breath. Take all your attention to your breath. Relax your face, your shoulders. Relax your breath. Don't do anything with your breath. Just try to focus on it. And try to see, where are you feeling mostly the breath in your body? Some people would feel the stress in their nostrils. Some people would feel the breath the most in their throat. Some people would feel the breath mostly in the chest. Sometimes it's in the belly. Wherever you feel the breath in your body, just try to take your focus to the part of your body where you are feeling the breath the most. Try to take all your focus to that part of your body where you are feeling the breath. And focus on the sensation of breath in that part. Then again, don't do anything with your breath. Don't make it longer, shorter, slower, faster. Just let it be as it is and observe and focus on the part of your body where you're feeling the breath the most. Focus on the sensation of breath. Now, while you do that, you're gonna notice that your mind will start to wander. You'll start thinking about other things. You'll have thoughts that will distract you from the focus point, which is the sensation of breath. So these thoughts that are drifting your concentration from the focus point are very normal. The brain usually follow thoughts from time to time. So if you notice that your mind is drifting away from the focus point and following some thoughts or images, positive or negative, irrelevant, that's totally normal. When you notice that your mind wandered, when you notice that your focus drifted away, gently bring it back to the focus point, which is the sensation of breath in your body. And when you do that, try to be kind with yourself. Don't say to yourself, oh, I drifted away, I lost my focus point. That's normal. What's important is when you notice that your thoughts and focus drifted away with thoughts, gently and kindly bring it back to the sensation of breath in your body. So I'm going to leave you silently for 1 minute with this exercise, focusing on the sensation of breath in the body, noticing that your mind is drifting away from the focus point. As soon as you notice that, bring it back to the focus point, then drift again, then back to the focus point. I'll stay silent and keep you doing this exercise, and then I'll give you more instructions to move to next stages of the meditation. Keep your eyes closed, focus on the sensation of breath in the body, notice the drifting away, and bring back the focus point. Now gently take your attention and focus to my voice, and from there move your attention to the top of your head and try to notice this part of your head. Try to notice if there is any tension there. Try to notice if there is tension, and if there is tension, try to relax it. Okay? Try to relax it as much as you can. And if you can't relax it, that's totally fine. Just observe it the way it is. Now move your attention to the muscles of your face, all your face, including the muscles of your jaw. And notice if there is tension there. Notice if there is pressure on your teeth. And if there is, just try to relax these tensions. Sometimes just by noticing the tensions, we can reduce them. And sometimes we can't. It's fine. Now move your attention back to the muscles of the neck, down to the shoulder blades, and observe this area. Try to see if there is tension there. If there is, try to relax it, if you can. Continue moving downward, down towards the arms, the upper arms and the elbows. And try to notice if there is tension there. If there is, gently try to relax it. Softly and gently try to relax. If you can, it's fine. If you can't, it's fine too. Move your attention now down through the forearms, the hands and fingers. Usually it's a part of the body where we see a lot of muscle tension. So try to observe if you can see some muscle tension there. If there is, try to relax it. Now we're back to the spine, to the upper back and the lower back. Take your attention there. Try to see if there is any tension there. Notice the situation of the muscles. Try to relax if there is some tension. Then move your attention down through the pelvis, the hips. Try to see if there is tension. Relax it if you can. Try to relax it. Keep moving downward towards the knees, the calves, the feet, the toes, and scan all these areas. Try to see and detect if you can observe muscle tension and if you can relax it. Now, after scanning the whole body, try to look back from a zoom out to your whole body after trying to relaxing each part. And now, try to see which part is still tense the most. Which part of the body will be not relaxed, that is bothering you the most with the muscle tension. Take your attention there. And now hold on to this part and with part of your attention, and take the rest of your attention to your breath. And try to imagine while you breathe in that you are breathing in a color, a soothing color, a color that you like, that gives you the feeling of relaxation, whatever relaxing color is for you. Try to visualize and imagine when you breathe in, you're breathing in a colored air with this color. And imagine the air, the colored air, or this color entering your lungs. And from there, just imagine in your imagination, try to send this breath with the color to this specially tense part of your body, whatever it is. It can be close to your lungs or it can be far. Try to take some deep breath. Take in this colored air with the color, whatever the color you choose, and send it down or up to the part of the body that is still tensed and bothering you. So you can do up to 10 breathings, each time sending the color to fill this part of your body completely and allow it to relax. 10 breathings. Deep breath. Allow this color, relaxing color, to enter your system and to go to the specific part of your body. Good. Now what we will do is we're gonna take your attention to a part of your body where it feels the most relaxed part. The most relaxed part of the body. The part of the body where you feel fine, nothing bothering you, no pain, no muscle tension. The best part of your body that feels okay, or at least neutral, that feels nothing. And now take all your attention there. Focus with all your attention on this part of your body. Then again, your focus might drift away with thoughts, and that's totally normal. As soon as you notice that your thoughts are drifting away, bring back your focus gently and kindly to this part of your body where you feel okay and fine and relaxed. And while keeping all your attention or most of your attention on this part of your body, try from this point of focus to have a long side look to the part of your body that is bothering you the most. It can be a muscle tension, it can be a joint pain, or it can be just the sensation of anxiety or stress in your chest. Any part, any kind of bother. So have a long side look with the main focus on the part of the body that feels fine, and from there have a long side look to the part that is bothering you, and try to put a score. How much is bothering you over 10? Then bring back all of your focus to the part of your body that feels fine and relaxed and nice. Stay a few seconds there. If your thoughts drift away, it's normal, bring it back. And then again, one more time, focusing on the part of the body that feels fine. Have a long side look to the part that is bothering you and try one more time to give it a score. Few seconds, long side look to it, and then back to the part of your body that feels fine and nice. And now take a deep, deep breath and open your eyes. And you can try to yawn and stretch. So in this mindfulness meditation, we had 3 levels. So it's important for you to understand and to be able to differentiate each level, because each one can be used for a different thing. And I know we may be used all the time. I'm gonna go fast through these 3 parts, and then the rest will become very easy and quick. So the first part is when we focus on the sensation of breath in the body, and we know that it's okay for our focus to drift away with thoughts, negative or positive, and we gently bring it back to the focus point drift away, back to focus point. We try to misunderstand meditation as if it's the capacity, or we need to focus and fight the thoughts and not allow thoughts to take us away from our focus point, which is totally wrong. Having thoughts and drifting away from the focus point is very normal, and we need to train the body that every time this happens, to notice it and to be able to bring it back. Being kind with ourselves means without punishing ourselves and saying, oh God, how did I allow my thoughts to drift away and to leave the focus point? That's normal, that's our brain. We need to be kind with our brain while doing this exercise. So that's level 101. Then from that, we move to the body scan, and we try to scan the tensions in all the body, then trying to relax them. And if we notice that there's a rebel part of the body that doesn't want or is not relaxing, we can do the colored breath. It's an imaginary exercise. We imagine there is a color and we send this color inside, we inhale it, we're breathing in, and from the inside, we send it to the part of the body, backward, front, up, down, and we try to inject this color, relaxing color, into this part of the body. That should help ease the muscle tension. Now, if it is still rebellious and it is still painful, it can be then again a sensation of stress or a pain joint, or joint pain or muscle tension pain. What we can do is we can teach the body and the mind to dissociate and not to allow this part of the body to affect the rest of the body. So to do that, we do step 3, which is focusing on the part of the body that feels nice and fine. And while focusing there, we have a long side look to the bothering part. Okay, and what we can do before moving to the step is when we focus on and we notice the bothering part, we can put a score over 10, how much is painful, how much it's bothering. Then we take the focus to the part that feels nice and fine, and we focus there, we spend a minute there, just like the exercise of the breath. We allow the thoughts to drift away, then we're back to the focus point. And from there, we have a long side look to the bothered part. Few seconds, and then we're back. Then few seconds, and then we're back. And every time we give it a new score, and you will notice, and your patient will notice, we can do this 5, 6, 7 times, and each time or every 2 times, the score of botherness will decrease. Well, that's interesting to be done before bedtime, because sometimes when there is a painful area, it bothers and it takes control of the whole mind, and all the focus will go to this painful area. And there is a golden rule: what we focus on grows. The more we focus on the pain, the more the pain will grow, and the more we'll be unable to sleep. So when we allow to isolate, when we allow the mind to isolate the part of the body and to focus on other part and have a long side look to the bothered body, we dissociate the rest of the brain and the body and the focus from the pain, and it can make the sleep easier. Okay, now this same exercise can be done for any pain, joint pain or muscle tension pain, not just for insomnia. Another exercise, I'm gonna go fast. Then another exercise can be done before bedtime, also to decrease anxiety, is to count from 100 backward, -3, -3, -3, -3. When we do a complex cognitive task, the brain cannot focus on the negative worrying thoughts, and this will stop the worrying. Positive planning and avoid empty time before bedtime. When we go to bed, put the head on the pillow. Usually we don't have plans. What do we think about? And the negative thoughts and the worrying thoughts start kicking in. So making sure to have a plan to think about something nice that we love, it's something very interesting that can help decrease stress. Sports and sunlight in the morning will help the secretion of melatonin in the evening. Okay, so it's good to practice this in the morning, and sunlight in the morning will have more melatonin in the evening, so a better sleep. Social communication, even though it's on social media, meaningful, satisfying, and interesting communication with people we love and trust will decrease the level of serotonin, and serotonin will help stress being decreased and will help sleep. Now, what else? Pain. So same mindfulness meditation, but we do the level 3 for joint pain, which is trying to dissociate the painful part from the rest of the body, focus on a nice part, have a long side look, and switch the attention a few times. This will decrease the pain, and also breathing in a relaxing color or a soothing color, and we send it to that part. Guided brain imagery, imagining yourself doing movement with precious objective. Okay, like ask the client to imagine himself doing movement with the painful joint in his imagination, but functional movement that are precious for him. Okay, and it's good to do the guided brain imagery after the mindfulness meditation, especially level 3 of it, where we isolate the painful part, we keep the focus on the part of the body that feels nice, and from there, it's very important detail, we move into guided brain imagery. Breathing for pain management and joint management, same thing for insomnia, but we need to install a regular practice, 10 minutes, 3 times per day. For muscle tension, it's the same, the meditation we already spoke about. Guided brain imagery right after the mindfulness meditation. You can ask the client to do stretching exercise of the painful muscles in the guided brain imagery, and the breathing, same like insomnia. And I am done. Okay, so if there are questions, let me know. Stop share.
Okay, Jad, thank you so much for sharing your valuable knowledge, and really we are thankful that you're here and you made us practice, and we are really glad to have you here. There are a few questions we have. I'll just ask few of those who are really relevant, and you can just answer the query of our participants. So yeah, the first question is, sir, I want to ask that chronic stress leads to chronic pain. So how can we get rid out of this? So I think you have answered this with
By
the stress
regularly
management.
practicing these exercises, regular practice, at least each one of the exercise 3 times per day.
Yeah. You have already explained that. Sir, what about people having asthma or any kind of related respiratory problems? Can this for 4,
Yes,
5, 6 principle could help?
all the above, all the above. Asthma is highly, and all allergies are related to stress, and stress can increase a lot asthma crisis. So all the above is a beautiful technique to decrease stress and improve sleep, and all this will improve the quality of breath with a patient suffering from asthma. Definitely.
Yeah, so what I could understand here is that the participant is trying to ask that the person will definitely have some shortness of breath. So they can modify their breathing pattern, not
What,
5, 6, yeah.
what they can do is to do the, instead of the 5 seconds in, 5 seconds out, they can do 4 seconds in, 4 seconds out. And before that, they can do some counting, the backward counting. They can do the mindfulness meditation, and this will decrease the stress already. And when the stress is decreased, their capacity to breathe will improve gradually, and they can do in a more effective way the breathing exercise.
Yes, Akshita, I
The
think your
benefit for
question
me
is
and the
also
poor
covered
part.
in this. Like if person has is not able to follow 456. So I think Jyoti, your also question is also
Yeah, they
covered
can
in
do
that.
3-4-5, for example.
Yeah.
But
So
then again, when
Mansi
we
is,
do the mindfulness, sorry, when we do the mindfulness meditation first and the backward counting, we decrease the stress, then the breath will improve.
yeah. There is another question that the Mansi is asking, in certain job condition, employee comes in a state of burnout, then how the person will manage his stress to work?
Okay, burnout is an advanced and complicated case of stress, and it's not part of these exercises. These exercises tend to have poor effects on the burnout. You know, in order to be able to treat burnout, we need, there are courses for stress management that are more advanced, and they will give you the capacity to deal with burnout and depression, which is a form of depression.
Yeah,
So
I
we
think
need much
what
more
you have,
advanced level of knowledge in the stress management field.
yes, yes, yeah, I think what we have you have taught today is basically focused on how to improve your sleep and how to take care of pain and
Yes.
change the behavioral part of pain management. Yeah. Yeah. So there is another question. Sir, can the tension area change during breathing exercises felt? The tension in clavicular area of the shoulder, then it switches to eye during breathing session exercise we had now.
I didn't understand the question.
Yeah, it is little confusing question. I think she is trying to ask that, sir, can tension area change during, can tension area change during breathing exercise? What
Of course,
she wants
of
to
course,
know,
of course.
that her tension area was changing. Like first she was having tension area in clavicular region, and then it shifted to somewhere else.
Very
So she
normal.
may have a multiple tension area.
That's normal. That's fine.
That's normal. That's it. So I think we have answered all the questions here. And once again, that we are really thankful from all the team Rehabilitation Sciences group that you joined us and share your
Pleasure.
knowledge. So thank you so much. And definitely
Thank you,
we will
Jack.
have your courses here in India, and we will launch. The people are very, very eagerly waiting that you to learn from you. So anything to say, Dr. Sagun?
Thank you, Dr. Jad. We loved
My
your
pleasure.
session when you had, yeah, from the 2018 to 2020, we are in touch with you. And I personally, I feel I got up a lot of things from your side. Okay. Sometimes I feel
An
relaxed
honor.
during the sleeping and for the treating of my clients. And with your breathing techniques, really, I find we can treat up any patient. Okay. If it is a chronic pain is there, or if it is any panic attacks are there, or whatever the things are there, we are able to do up. So we would love to invite you again in our country, and we would like you should conduct up a lot of courses for our students and for our physiotherapy fraternity.
Hopefully things
Yeah.
will get better and we will meet soon.
Yeah. Thank
Yeah,
you, Jad.
definitely.
Thanks you once again.
Definitely.
And
Thank you.
thanks
My
to all the
pleasure.
participants who have joined this session. And on behalf of all the Rehab Sciences group and all the participants, once again, thanks to Jad. And soon we will have another session, or once the situation improved worldwide, we can invite him to India back and we can have a live session. So thank you so much for joining us. Thank you. Thank you.
Thank you.
Take
Thank you.
care. Bye.
Thank you.